and I'm Dannielli. Nice to meet you. I'm the nurse that's going to take care of you today. We are our winner for our Botox contest. You excited?
I'm super nervous and
I
excited.
bet you are. Come on over. We're going to go this way. Is this your first time getting Botox?
I haven't done here on my upper lip before, but
Just a little, I like to call it like a soft rejuvenation, a refresher. You want to just look, very natural still with fillers or Botox. So it just depends on how much we put in the area, what your muscle requires when it comes to Botox. And fillers also just kind of depends on what look you're going for, and it's just kind of slowly building you to that so that it feels more natural and it looks more natural.
perfect.
You can lay your things down. So tell me what areas concern you.
I want to do the lip flip, and then like right here, I'm starting to see like little lines.
Mm-hmm.
And the other thing, I don't know if this was something that could be done, but like how it kind of raises the brow a little bit.
Mm-hmm.
So I saw some pictures.
Yes.
So whatever you think would look the best and whatever I need.
Okay, good. So to improve the little lines right in here, we generally want to treat, and I'll show you. We want to treat these muscles here. So to improve here, this is what it looks like where I would be injecting to relax these muscles up here. And these are called depressors. So these muscles usually are the ones that pull everything down and in. So once I inject there, they're going to relax and kind of soften and kind of brighten and kind of lift you a little bit in this area. So we'll be injecting there. Now to help some of those lines that you've pointed out kind of a little bit higher right in this area, it would help some here, but we really need to inject the rest of the forehead so it looks natural that way. Otherwise, this doesn't have much movement, but then this still has, and then you're really going to see the little lines right in the middle of where we didn't get treated. So generally, if we're going to treat between the brows, it looks best if we treat the entire forehead, and so it just looks even and nice that way.
Okay.
So I would say we'd want to do some, a little bit of Botox in there, and we would just do a light dose. These are the recommended doses, 20 units between the eyebrows. It's what the data shows to give you a really great result there, really relax that muscle. Of course, some people need more or less, but 20 is kind of like the standard that looks good there. Now on the forehead, we can go up to 20 units. I would say 10 units would be a good place to go for you on the forehead. Just a light relaxation. And generally it takes up to 2 weeks for the Botox to have its full effect. So I always like to schedule you back in 2 weeks so that we can take a look at how everything just kind of turned out, see if there's still some movement, a little bit of movement anywhere. And then that means you require a couple more units just to really change everything.
Perfect.
So, but yeah, so I wouldn't quite do 20 on the forehead, 10 would be really nice.
Yeah, because I know I don't have like a ton of wrinkles, but just something, like I'm still young and I know that.
Yes.
But I just want it to not be as like, I see them.
Yeah, and that's what's important. If you see it, if it's something that's concerning you, that's what this is for, to help you feel extra good about yourself. And it's preventative too. We have young ladies coming in as early as 23, 24 because genetically they can see on their, maybe older sisters or mom, how the lines are starting to come in or how they've come in. So it's better to prevent it if possible, then you will never have a wrinkle. I won't tell you my age. It's everyone's favorite, the Hydra Facial. Oh my gosh, I call it the deep carpet cleaner. It goes in there and it just flushes everything out. It's a device and it has different serums with like fruit acids in there. It kills bacteria and it just, you see all the impurities that come out in the jar. It's like amazing. So that's a good way to just clean you up and kind of start kind of fresh. It helps with that masking too.
Yeah, I definitely need to get one of them. It's on my list.
Yeah.
I'm doing family photos and
Oh.
not this weekend, but the following weekend.
Oh, good.
So
Yeah.
I'm super excited
draw out exactly what you need. We're gonna go 20 units for your glabella between the eyebrows. There we go. Beautiful, 20 units. We're gonna do that between the eyebrows. And then I'm just gonna draw out the 14 to treat the other little areas, the forehead, and then to do your little lip flip, okay? Yeah. And I know a lot of people are nervous in needles, and you know, I totally understand. Being a nurse, you know, I've had to in the hospital start IVs and inject patients, and it's hard. It's scary for everybody, needles. So I'm just gonna go 14 here. But I'll talk you through it.
Sounds good. When I had my son, I was more nervous of getting the IV and the epidural than actually having a child. That says anything at all about needles.
Yeah, I understand that. It is. It just sounds scary, right? Just kind of going in, but at least this is teeny weeny, which is cool.
Yes, it's the smallest needle I've ever seen, so I like that one.
I know, it helps that it's little. So, okay, so I'm just going to mark you really quickly. I like to be very precise to where we're going, so I'm going to require you to just do some movements for me, okay?
Okay.
And you can lean back if you'd like. All right, so let's squeeze the brows strong again.
I can never make these faces because I don't want to get wrinkles.
Good, don't make those faces. And the Botox is going to help you not make those
Yes.
faces. Good, so we're going to go right in the middle there and let's squeeze again. Okay, now it's going to go right here. And then right there. And right there. Right in the belly of it. Good. And then let's squeeze again for that side. A lot of work squeezing.
I know, I feel like I'm working out.
You're working out a little bit. Yeah, this is what is the hardest part of it, is just doing all this kind of takes the longest. Because I just like to be really precise because everyone's muscle is a little bit different. One more time. Okay.
This will be the fastest workout with results I've ever had.
Yeah, I know, right? Okay, that looks good there. Now, let me have you raise your eyebrows. See what your brows pull the most. Okay, so I'm just gonna go a little bit right here. Alright. That one you don't need to do anything for. No exercising the mouth for that.
Can I drink out of straws today?
Well, we usually say it's best not to.
Okay.
Yeah.
I won't do that then.
Just like the sippy cup types is okay. Just
Okay.
straws cause more wrinkles around the mouth, on the mouth itself, and especially since we're doing the, this here to relax that muscle, we don't want you overworking that muscle with straws for the next like 2 days usually, okay?
Okay.
So that way you can get the best result there. And you know, no laying down for 4 hours after Botox.
That works. I don't think work would like it if I laid down.
Yeah, they would be like, what are you doing there?
You're coming in late and you're trying to take a nap here.
I'll have you make movements again,
Okay.
okay? But first you did good. And nice deep breath. And relax. And then go ahead and make that little squeezy brow. Okay, here we go. Is that okay?
Mm-hmm.
Good job. So I'm just gonna turn my needle so I can see. Okay. You're doing good. So you're just gonna feel a little bit of pressure filling in. Perfect. Good. All right. And then let's have you squeeze again. Okay. And you can go ahead and relax for me. It usually makes a little crunchy sound there. Good. And it's always normal to have a little dot of blood. It's kind of like when you prick your finger, you know? That's totally normal. Now let's squeeze again. There we go. Nice. That looks good. Now let's just do that other little side. Let's have you squeeze again. Almost done with the between the eyebrows there, okay?
Perfect.
Okay, let's have you squeeze again. Good. You can relax now.
I thought it was gonna hurt a lot more.
Oh, good. I'm glad. It's generally not painful, too painful, but it depends, you know, on technique sometimes, depends on how heavy-handed someone is, you know, it doesn't mean their work's not gonna be beautiful, but it's nice if we can be as gentle as possible, so I understand. Okay, perfect. So now we're just gonna go into the forehead, and that's not too bad either. And then we'll do your little lip flip. It's gonna look so pretty. You've got pretty, you know, shaped mouth already, so nice. It's just a little bit of a lift in volume there. Okay. So we're just gonna do 10 units total. So I'll have you raise your eyebrows again. Go ahead and relax. Just a little pinch, you got it. Okay. One more little unit from this guy.
What is the youngest person that you'll treat?
Well, we treat 20-year-olds. I mean, that's, I would say, is the youngest I treated. And once again, it's very dependent on if they have really strong genetic traces to have those creases young, you know, across the forehead or between here. Sometimes you can see that it's like, wow, they squeeze that muscle so strong. You can already see a little line starting out even in your early 20s. So that's someone we want to try to treat if they want to, you know, if that matters to them, we can get them started already. Okay, here we go. Just gonna go my little middle one, and let's have you raise again. Okay, go ahead and relax. Here we go, just 2 units here. Perfect, and raise again. Okay, relax. Hopefully a little relaxing music helps too, right?
Yes.
Just look at that beautiful forest image.
It is kind of relaxing.
Oh, good. I'm glad you like that. Here. Okay, put a little pressure there. How's everything feeling?
Okay.
Good. Just a little red here and there. And as we know, just a little dot of blood. And that's all coming out pretty good.
When will it start to show?
Good question. So it takes a few days, sometimes 5 days or so to start to show, and 2 weeks for full result.
Okay.
Yeah, it's working with your muscle, and it just takes a little time to fully get it to relax to what we need it. But yeah, in a few days you already start to see like, oh wow, I can see that it's relaxing, it's looking smoother, so it's really good. So let's do now a little bit on the lip.
I think that's my favorite part of Botox is like looking in the mirror every morning and just seeing it kind of like set in. You see it, you get to see it work, you know, it's kind of crazy.
It is, it's just so nice. It's like, oh, looking more refreshed each day here.
Yeah.
So good. Okay, so I'm just
I know, I'm excited for my lip, I think the most. I hate that I have such like a thin upper lip, but I don't want it to be fat, I just want it to be like more visible, I guess.
Yeah.
And I made a comment to my mom, she's like, I love your lips. I'm like, we have the exact same lips. Like,
Oh, cute.
like okay.
Yeah.
Identical. Yeah, I mean, this is a good way to just have them evert, kind of open up a little bit. And just saying, if you ever want fillers, it doesn't have to look exaggerated. There's different types of fillers for lips now. Some of them we call it almost like a lip plump lipstick style filler, very tiny molecule, totally hydrates the lips, helps to lessen some of those little vertical lines on the lips, and just give them just a soft plump. So I'll be posting, I did a really soft one yesterday. I'll be posting that in 2 weeks after she's all settled in on our Instagram, and you'll see it. But yeah, yeah, just a soft little, you know, and it brings a lot of moisture to the lips, so the lips always look so hydrated and nice.
It's mine are super dry right now.
Everybody's, it's this town. We just get very dehydrated here. It's the desert, and in the winter everything gets drier. Okay, so here we go. We're just gonna do 2 little units in there, okay? And you just stay normal there. Here we go. This is a little bit more uncomfortable. Sorry, honey. Here we go. You're doing good. 2 units. Sorry, I just gotta flip my little needle. Okay. You got it. Makes your eyes water. That one makes your eyes water for sure. You know, lips, everything's sensitive on lips.
I know, it's like you can't even wax your lip.
That's what I was gonna say.
I'm so thankful I don't get like,
Yeah, you don't have the dark mustache.
yeah. For a reason, I do all water works.
Yeah. Yeah, there's little nerve endings there, and those nerve endings get triggered by waxing or anything. So just 2 little less units there, and then you're done. Yeah, that looks really good. Okay, here we go. And stay nice and relaxed for me. Make sure we're right where we need to be. Sorry, hon. You're doing good. Breath hold and done. Deep breath.
Okay.
You did excellent. Everyone's eyes water for this.
Mm-hmm.
They just do. It's just that little
It's
prick.
sensitive right there.
Yeah, that little prick there, but you did so good.
The forehead's relaxing.
Yeah, can you feel that it doesn't really
Yes.
hurt there? Okay. I'm just gonna finish cleaning you up a little bit,
Perfect.
and then I'm gonna apply little Arnica Gel. It just helps to soothe and calm the area. And you know, anytime we get injections, any kind of like little, you know, blood draws, there's a possibility for bruising. That's just normal. Bruising, a little bit of swelling can happen. Sometimes on the lip, you know, you may just feel like just a little bit of minor swelling there. It doesn't look like you're gonna bruise to me. Everything looks really good. But just know that that is normal, and it lasts a few days and then it goes away. So just gonna apply the Arnica Gel, and you can get this at, you know, Walgreens or at definitely Sprouts, and it's just a soothing, calming, natural kind of product that helps with any kind of like bruising or just sensitivity. So I'm just gonna apply a little bit there. So no laying down for the next 4 hours,
Okay.
no exercising for 24 hours.
I'm good with that.
You're good with that. Good. You're nice and fit already. And then no rubbing and no hats on the area we treated, okay? And no straws I know that's a hard one. You enjoy your straws, huh?
Yes. I have to keep them at work. I keep a stash in my car.
Oh, yeah. It is nice. Yeah, just for at least 2 days if you could. Just to let everything just kind of settle in. no massaging the area, so I'm just kind of gently dabbing here, okay?
Perfect. But like when I wash.
So this redness and the little raised bumps, that all goes down in about 30 minutes or less usually. Just kind of, it depends on each individual, how their body is. But that all should just kind of look nice and normal here in the next close to 30 minutes. The lip looks really good. It's not, irritated anything. Everything looks absolutely normal. You did really good.
Awesome. Thank you.
You're welcome.
I'm excited.
And we're gonna send you home with your post-care. And basically it's just going to go over what I told you about the no laying down for 4 hours and no exercising for 24 hours. And to also know that once again, it takes up to 2 weeks for full result. I'd like to schedule you back for your follow-up, and then at that time, we'll decide if that dose was just right to get the results you needed, because it depends, everybody's anatomy is a little bit different, but I did kind of the standard, normal, and we just went a little lighter on the forehead, because I felt that just might be enough for you there. And then at that time, if you want a little, brow raise, we can always do that too.
Perfect. And how many units would you do for a brow raise?
So that wouldn't be very much actually, just about total 4 units to just give you a little bit of a brow, kind of little lift there if we still want to do that.
Okay.
But we'll let everything settle in. That naturally usually lifts you a little bit, and then we can always go in and just give you a little more of a brow lift if you'd like.
Sounds good. Thank you so much.
You did so good. So proud of you. Good job.
Thank you.